Hello, everyone. Today's video is another Q&A video talking today about concerns about high-dose vitamin B12 possibly being linked to cancer development, talking about how to access the Safe and Sound protocol, and also talking about chronic embedded UTIs, urinary tract infections. As per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if at some point you wouldn't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. I'm in between phones right now, so I'm doing this video on my computer via Zoom, so hence the funky headset. And I don't know if anything else seems different about the videos. That's why. So I'm going to. Well, apparently I cannot minimize this a Zoom uh, box while recording a video. So okay, there we go. Got it all figured out now. So let's see here. First one here says, so I posted a video recently about using a high dose vitamin B12 using methylcobalamin protocol. And so comment here saying, let's see, what do you do if you can get the serum level up, but the methylation is not working, which is ultimately would lead to neurological issues? And then what do you think about the increased risk of cancer from high dose B12 and B6? I've been taking full doses of oral B12 and I'm kind of freaked out about that. Maybe you can give us your thoughts on that. So, so I guess the first question there about what can you do if you can get the serum level up, but the methylation is still not working? Um, I guess the question would be like, what would the evidence of that be? So, if, obviously, if the serum levels are elevated, then that's pretty obvious. But then, how do we know the methylation is not working? Is it that there was additional testing that was done looking at methylation cycle parameters and they're still off kilter, or is it that the B12 is just not actually having a clinical impact? If it's if the evidence of methylation not working is lack of clinical impact, then it might be because methylation underfunctioning isn't really the underlying problem. Maybe it's actually not a methylation issue. Other things can cause the symptoms that we might clinically attribute to methylation underfunctioning, and it's actually related to something else. If the question is more around like, yeah, I had a methylation cycle test done and say my like S-adenosine level was low, so I tried taking more SAMe and say maybe my homocysteine level was high, suggesting that there's a blockage there, maybe like at the methyl B12 level or on a methyl B12 level. And then like, why didn't it work? Well, it might be because we need to bring methylfolate into the mix potentially. There might be certain other cofactors that are missing that might be important, like say vitamin B2 potentially. It might be that there's some other backlog happening. Maybe the homocysteine is backlogging because it's not going through the CBS, like the oh my goodness, CBS. Um, beta cystathionine pathway. It's cystathionine beta synthase. That's what it is. That's what CBS stands for. It's not going through that pathway properly. So maybe we need vitamin B6 or certain other cofactors to work that pathway. Maybe the S-adenosine is getting used up excessively, and that's why the level's low, not because the B12 level's not high enough. So like there's a few different moving parts there. So if you want to post again with elaborating on sort of the more specifics around that question, I'm happy to answer as best I can academically. But I'll leave that part there for now. As far as the question about cancer and vitamin B12 and vitamin B6 goes, so this is an area that I've dug into quite a bit because I treat a lot of patients with a cancer diagnosis, and I work a lot with methylation and vitamin B12 as for patients that need that. So they're can how do those intersect? My understanding from the research literature is that there's no definitive evidence that a higher dose methylated B vitamin intake is going to be associated with increased cancer incidence. There are definitely studies showing that if we have excessive methylation, then that excessive methylation is a potential mechanism in a number of different cancer cell lines. But we don't have any evidence telling us whether or not taking excessive or like higher than standard dosages of methylated B vitamins might exacerbate that or not. Um, the kind of analogy or the comparison I would draw would be, so we know that cancer cells, as a rule, really benefit from taking in a lot of glucose. They can use other fuel sources as well, but they really like glucose. And so one would think that, oh, if I just try to get my glucose levels down low enough, then I can kind of starve out the cancer. Wouldn't it be nice if we could do that? But we know that the body adapts in such a way, or like the human, like our physiology adapts in such a way that we're always going to maintain a certain level of blood glucose. So even if we're eating nothing but fat on a ketogenic diet, or we're eating nothing but protein, through the process of gluconeogenesis, the body is going to turn fat and protein into blood sugar. Even if we just fast straight up, so I'm just going to water fast this cancer away, well, the body will gradually start breaking down muscle and fat stores, glycogen stores to make more glucose to maintain that certain baseline level of blood sugar. So, sort of in a roundabout comparison kind of way, um, the cancer cells are going to be able to scavenge what they need regardless of what we're doing nutritionally. So perhaps in a similar vein, the cancer cells are going to methylate regardless because all of our cells methylate. And even if we're maybe generally under methylating, cancer cells seem to have a lot of strategies in place to get around things that might otherwise be deficient. They kind of, they're scavengers. They find a way to make it happen. So it's plausible that regardless of what we're doing with our intake of methylation supports, the cancer cells are going to do just fine without that extra methylation support. Will adding in that extra methylation support, like higher dose of methyl B12, make the problem worse? It's a good question. My understanding is there's no clinical trials actually looking at that, so we really don't have the answer to that. So it's definitely something to keep in mind, and it's certainly something I keep on my mind, especially with patients who do seem to benefit from higher dose methylated B vitamins. They um, I always try to have my patients get away with the lowest dose that they can to feel good, and then keep them on those higher dose methylated B vitamins for the shortest duration possible. So if they're feeling good on, say, 5 milligrams injected, every few days or something like that, and they seem to be doing well at the 1 month follow-up that I have with them, say, hey, that's great. Why don't we see if you can get away with 4 milligrams? And if that's going okay, let's go down to 3. Let's go down to 2. Let's try to space it out as much as we can. Not that we're treating it like kryptonite or anything like that, where it's like, oh my gosh, we got to try to like get this dose down ASAP. But we do want to be, I think, mindful about, not having too much methylation in the mix because we just don't really know for sure what those long-term effects might be. If there's no cancer in the body currently, then it should theoretically have no issues whatsoever. People can overmethylate, but if they're already feeling good on the high dose B12, then we can assume they're probably not hypermethylating. So that's probably not an issue. But if there was cancer brewing somewhere in the body, it's like, yeah, maybe it could have a negative effect. So it's one of those things where we just don't really know. Similarly, we don't really know about lots of things. Like patients will sometimes ask, it's like, yeah, I've been on this SSRI drug for like, 20 years. Like what are the effects of that? It's like, oh, nobody's ever studied that. We don't know. I mean, maybe they have, but I have not seen that study. Lots of things, we just don't know. So we put on our thinking caps, we observe what we see in practice, we try to make our best, our best judgment calls, and I think just generally try to get patients off medications and supplements as soon as we can when they don't need them anymore. But sometimes that's easier said than done. Anyways, starting to wax some philosophy there. I'll leave it there with that particular question. So thank you for the question. Very good question. I am talking too much about methyl B12 here, so I'm running out of time. I don't think I'm going to get to the chronic embedded UTI question, but I will just quickly talk about accessing the Safe and Sound protocol. So at least I'll get to two. So with the Safe and Sound protocol, I posted a video about this recently. I've posted a couple of other videos if you're interested in learning more about that. I posted a couple of videos over a year ago now, I'd say, just going over like what is the Safe and Sound protocol, what's it all about. But anyways, to access the Safe and Sound protocol, my understanding is the only way that one can do that is by working with a provider who is Safe and Sound protocol certified. So someone who has gone through the training program and learned how to deliver the Safe and Sound protocol. And then that's the way to access the Safe and Sound protocol. So you have to find a clinician who's done that training. So I'm one of those clinicians. There are many of us out there. You can go to the Safe and Sound Protocol website, and there's a list of folks on there, I believe, who have done the certification, or just do a search engine search for Safe and Sound Protocol clinician in my area or something like that, and something should come up. But yeah, you can't access it on your own. You have to access it through a clinician. I will get to that chronic embedded UTI question. Apologies for talking too much about B12. I'll get to it as soon as I can. Any questions or comments on any of these topics, just post in the comment section below, and I will get to them as soon as I can.